Good afternoon, all of you. So today's topic will be on acute respiratory tract infection. So what was our last topic? So last topic was infection which is transmitted through respiratory route. So can you give me the examples of infections which is transmitted through respiratory route? Pox, mumps, measles, rubella. So all these infections are mainly through respiratory route. So now coming to the next one, so acute respiratory tract infection. So acute respiratory tract infection, so you all know. So ARI, we got as ARI. So may cause inflammation of the respiratory tract, anywhere from the nose to the alveoli. So with a wide range of combination of symptoms and signs. You all know. So what is the main signs and symptoms of acute respiratory tract infection? So we can classify them as acute respiratory infection, that is upper respiratory tract infection, and lower respiratory tract infection. So upper respiratory tract infections include common cold, pharyngitis and otitis media. So lower respiratory tract infections include epiglottitis, laryngitis, laryngeal tracheitis, bronchitis, bronchiolitis and pneumonia. So this is how we are classifying this acute respiratory infection as lower tract infection and upper tract infection. So clinical features. So most of all of us are aware about the clinical features. Here the clinical features include runny nose, cough, sore throat, difficult breathing and ear problem. So fever is also common in acute respiratory tract infection. And what is the current epidemic, which is also mainly through respiratory route? Infections through respiratory route. Yes, COVID. So COVID is also, infection is also mainly through the respiratory route and which is affecting the respiratory system. So fever is also common acute respiratory infections. And most children with these infections are only mild infections. So they have mild infection which can be as a cold and cough and then it will However, some children may have a pneumonia, which is a major cause of death. So, acute respiratory infection is one of the major cause of death, infant deaths in our country. So, it's the first major cause of infant deaths in our country. Mild cold, cough, and fever, it will subside on its own after 3 to 4 days. But the patient is going for pneumonia or complications, then we have to manage the patient carefully. So in less developed countries, measles and whooping cough are major cause of severe respiratory tract infection. So that's why we insist mainly on vaccination. So all the vaccination has to be given to the child up to date. So measles and whooping cough are another cause for this respiratory tract infection. So what is the problem statement? Epidemiology of acute respiratory infection. In India, in the states and districts with high infant and child mortality rate, acute respiratory infection is one of the major cause of death. So it can be asked as an MCQ, what is the major cause of death? And ARI is also one of the major reasons for which children are brought to hospital and healthcare facilities. So when you sit in the OPD, the pediatric OPD or the medicine OPD, you can find out of 50 patients who are coming to the OPD, mostly 30% of the patients will be having this acute respiratory infection. They would have come for mainly for cold, cough, fever, etc. The hospital records from states with higher infant mortality rates show up to 13% inpatient death in pediatric wards are due to acute respiratory tract infection. So that is the main cause of infant deaths in our country, that is in developing countries like ours. So performance indicators of acute respiratory tract infection management in India. So inappropriate antibiotic use for cold and cough. So 65%. Children with pneumonia not given antibiotic 19%. Respiratory rate counted 22%. Chest syndrome checked 14%. Caretaker knows the correct 4%. So we should always teach the healthcare worker as well as the mother to know or to identify whether the patient is having mild cold cough or the patient is going in for pneumonia. So how we can educate them is mainly by counting the respiratory rate and to see whether the chest indrawing is happening, to check whether chest indrawing is happening and to count the breaths, number of breaths per minute. So with this we can identify the patient is having normal cold cough or the patient is gone in for pneumonia. So what is the agent which is causing this pneumonia? Bacteria and viral infection. These both can cause pneumonia. So bacteria, we can have Bordetella pertussis, Corynebacterium diphtheria, Haemophilus influenza, Klebsiella pneumoniae and Legionella pneumophila. So these are the bacterial agent which is causing pneumonia. Viruses like adenovirus, enterovirus, influenza ABC, measles, paramyxin influenza 1, 2, 3. So these are the viral infections which is causing pneumonia. And other agents like chlamydia, Coxiella burnetii, Mycoplasma pneumonia. So other fungi or other infections which is causing pneumonia. So anything can cause pneumonia and which has to be monitored carefully. Host factors. So who are all the host factors? So most commonly affected are small children. Case fatality rates are higher in young infants and malnourished children. So all know malnourishment leads to infection and which again leads to malnourishment. So it is a vicious cycle. And developing countries where malnutrition, low birth weight are often a major problem. The rates in children tend to be the highest. So what is the normal birth weight of a child? So usually we say 3 kgs. So in developed countries they say less than 3 kg, we call them as low birth weight children. And in developing countries like ours we say less than 2.5 kg as a low birth weight children. Most of the babies born are low birth weight and they go for malnutrition and they develop all these infections. So that's why we give proper care right from the antenatal period throughout the delivery and through the postnatal period, so that we don't want the child to develop all this problem and go for malnourishment. Okay, so what are the risk factors? Why this is spreading? So risk factors is overcrowded dwelling. So people living in slums, maybe in urban or rural slums, overcrowding is the main cause. Poor nutrition, low birth weight, intense intake, indoor smoke pollution underlying the high rates. So people living in rural areas and in slums, they use all this solid fuel for cooking, and which produces more smoke. And if the child is prone for this infection, they are having more problems. High rates infection is common in younger sibling of school-going children who introduce infection to the household. So when the children starts to go to school and then they are exposed to other children in school, and they might have this infection. And from there they take the infection and come back and they give their siblings also the infection. And maternal cigarette smoking is also another cause for this acute respiratory tract infection. So we should keep it in mind. What are the things, risk factors? So overcrowding, poor nutrition, low birth weight, indoor air pollution, cigarette smoking, maternal cigarette smoking. So these are all the major risk factors which is favoring this acute respiratory tract infection. So what is the mode of transmission? So you all know acute respiratory tract infection, mode of transmission is through airborne route. So virus or bacteria do not survive long outside the respiratory tract. So the chain of transmission is maintained by direct person-to-person contact. Clinical assessment. So how you will assess the patient physically? Physical by doing the physical examination. So fast breathing is present when the respiratory rate is. So when do you say the patient is having fast breathing? So it depends upon the age of the baby or the child. So 60 breaths per minute or more in a child less than 2 months of age. If the child is having more than 2 months, more than 60 breaths per minute, then we call them as the child is having pneumonia. In case of less than 2 months of age. If the child is having more than 50 breaths per minute, the child is from 2 months to 12 months of age group. And 40 breaths per minute or more in a child aged 12 months to 5 years. Then we can say the child is having pneumonia. So mainly because by counting the breaths, respiratory rate. So mother or the caretaker or the healthcare providers or the Anganwadi workers should be taught how to find out whether the patient is having fast breathing or not. Okay. And next one is looking for the chest indrawing. So the mother should know whether the child is normal or there is any indrawing of the chest muscles, chest wall muscles which is indrawing during breathing. So it takes more effort to breathe. The child takes more effort to breathe. So there will be indrawing of chest wall. And look and listen for the stridor. Now the mother has to look and listen for the stridor. They should hear any noise is coming during breathing or inspiration or expiration. And look for wheeze. And child is abdominally sleepy. So the child is not active and always tend to sleepy and drowsy. Feel for fever and check for severe malnutrition and cyanosis in case of hypoxia. The child is not getting enough oxygen, so child may go for have cyanosis. So check for this. All these signs and symptoms has to be checked. So classification of illness, how you will classify? For child age 2 months up to 5 years, we can classify them as having very severe disease. Severe pneumonia, and no pneumonia called or cough. So very severe disease, severe pneumonia, cold or cough. So when you say we call it as very severe disease, when the child is not able to drink, convulsions, stridor, informed child, and severe malnutrition. Convulsions, abdominal sleepy, wake up, stridor in calm child, severe malnutrition. We call them as very severe disease. So what is the treatment for them? Refer urgently hospital. So patient has to be hospitalized. The child has to be hospitalized. So we first also find it. Treat fever if present. Treat if present. If severe malaria is possible, so these are the treatment protocol which has to be followed when the patient is referred to the hospital. An antibiotic has to be selected appropriate, like cetron or sulfamethoxazole or trimethoprim combination or through Amox or whatever drug which is tolerable and which is effective to the patient. Severe pneumonia. Respiratory rate. Severe pneumonia. So respiratory rate. So look for the respiratory rate. Chest indrawing. Chest indrawing may be the only sign in child with severe pneumonia. And child with chest indrawing is at higher risk of death from pneumonia than a child with fast breathing alone. So these are all the main factors which you should be noted to say the patient is having severe pneumonia. The child classified as having pneumonia and other signs such as we can say the child can have nasal flaring where the nose widens as the child breathes in. Grunting, the short sounds made with voice when the child has difficult breathing. Cyanosis, a dark bluish or purplish coloration of the skin called hypoxia, caused by hypoxia. So these are all the other signs and symptoms which can be noted if the child is having pneumonia. So nasal flaring, grunting, cyanosis. And next one is pneumonia, which is not severe. The patient will have fast breathing and no chest indrawing. So only fast breathing alone is enough to say the patient is having pneumonia. No pneumonia, only cold and cough. So those children do not need antibiotics. Such cases of viral infections for antibiotic are not effective. Child with cold will get better within 1 to 2 weeks. A child with chronic cough, so that has to be tested. So if it is more than lasting for more than 30 days, then you have to go for to see whether the child is having tuberculosis. So go for acid fast bacilli sputum examination, and whether the child is having asthma or coughing cough. So we have to find out. So classifying the illness of young infant. So young infant, how are we going to classify? Some of the danger signs of very severe disease are convulsions, abnormally sleepy or difficult to wake. The child might have convulsions and they may be drowsy, difficult to wake. Stridor when calm, not feeding well, wheezing, fever or low body temperature, maybe high or low body temperature. So we can classify them in younger infant. So it's a danger signs of very severe disease. So what is the treatment protocol for these children of 2 months to 5 years of age group? So we will give pediatric tablet depending upon their weight, that is sulfamethoxazole trimethoprim. The pediatric syrup is available. So of each spoon which is containing 5 ml containing sulfamethoxazole trimethoprim. So less than 2 months, you give 1 tablet once a day. If you want for syrup, half spoon twice a day. So 2 to 12 months, 2 tablets twice a day and 1 spoon of syrup. 1 to 5 years, 3 tablets twice a day, 1.5 spoon syrup. So depending upon the weight and age of the child. Severe pneumonia treated as inpatients with intramuscular injections of benzyl penicillin, ampicillin or chloramphenicol. So any of these drugs can be given, and before these drugs are given, the test dose has to be given and to see if any allergy, anaphylaxis or allergic reactions occurs. After that, we can go for the injections. Antibiotic therapy must be given for minimum of 5 days and continued for at least 3 days after the child gets well. Okay. So prevention. How we are going to prevent? For primary prevention. So primary prevention. So what are we going to do in primary prevention? So what is the primary prevention and modes of intervention? So primary prevention. What is primary prevention? So many times we have taught, but still no answer from you. So you can give the answer. So primary prevention, health education and specific protection. So health education and specific protection. So we have to teach the caretaker, Anganwadi workers, mothers how to identify, and specific protection going for immunization, proper immunization, proper antenatal care to prevent overweight babies, proper immunization to prevent any infections. So primary prevention is very important. Improve living conditions. To improve the standard, to improve your living conditions. Better nutrition. So in every Anganwadi and Balwadis, they are giving supplementary nutrition, so which can be utilized or benefited by the children who are malnourished or undernourished. Reduction of indoor air pollution by having proper space for the smoke to go, and better MCH care, maternal and child health care, right from the day of conception to the delivery and after till the baby's child is up to 5 years of age group. So proper MCH care right from the antenatal to the 5th year of the child. Like which is including antenatal care, immunization, postnatal care, family planning, proper weaning, breastfeeding, proper school health care. Okay, so all these comes under maternal and child health care. Immunization. So the child has to be immunized up to date. whenever is necessary. So everything has to be immunized. Community support, awareness among family members. So these are all the preventive aspects to prevention of acute respiratory tract infection. What is SARS? SARS, SARS. So it is a severe acute respiratory syndrome. So any disease, any respiratory tract infection can go for the SARS, like severe acute respiratory distress or syndrome. Okay. So suddenly the baby or the person is not able to breathe properly. So we say the patient is gone in for respiratory distress. Any infection can cause this acute respiratory distress. This is commonly caused by the virus new strain. Now this new strain also has come now, the coronavirus. So originally we had all this SARS, influenza, swine flu, and all those things. Now this corona has also added to the infection. So what are the clinical features? The patient, after the acquiring infection, they can have fever, malaise, chills, headache, nausea, dizziness, cough, sore throat, and runny nose. So as it is very common in all acute respiratory infections, so you might have fever, body pain, chills, headache, myalgia, dizziness, cough, and sore throat, and runny nose. So all the respiratory infection will present with similar clinical features. In some cases, rapid deterioration with low oxygen saturation leading to death in 10% of cases. So in this also, corona also we used to have all this. Everywhere you have seen, I don't know, as you have seen, everywhere we saw this pulse oximeter selling. Even in the bakery shops, even in the textile shops, textile showrooms, malls, everywhere we are having this mask and this pulse oximeter so that you can easily identify the saturation level of yours, so that you can identify whether you can stay at home or can get as hospitalized. So oxygen saturation is a very important indicator to find out whether you have any problem or not. X-ray finding shows small unilateral patchy shadowing and progress over 1 to 2 days to become bilateral nebulized interstitial infiltration. So next one will be the X-ray findings, where we can see all this patchy shadowing and infiltration in the lungs. So within 2 days, it can become worse also. So incubation period is 2 to 7 days, and mode of transmission through respiratory droplets from close contacts. So that's why we say all of you use mask, follow social distancing, and use all this hand sanitizer and water and soap to wash your hands. And don't go close to anyone. So you usually go for the social distancing so that you will not acquire all this respiratory infection. So SARS virus can survive for hours outside the human body. So it is spread everywhere in the atmosphere. So always use mask when you step out of your houses so that you can prevent yourselves from all these life-threatening respiratory infections. So case definition, how you define suspect case. So fever more than 38 degrees, cough or breathing difficulty, close contact with SARS, history of travel to SARS affected area, residing in affected area. So these are all the case definition. So this is applicable even to this coronavirus. So we say fever, cough and cold, cough, breathing difficulty, people living contact with this corona cases and all those things. It's similar. So case definition is by this patient living in contact and nearby places or in the place of affected area. Next one is deaths due to acute respiratory infection, which will be informed to the health authority when is close contact with SARS case, history of travel to SARS affected area and residing in affected area. So deaths due to ARI in all these three aspects: close contact, residing and history of travel. So with this we can find out the patient is having SARS or any other respiratory illness. And what is called as probable case? The suspect case with radiological evidence, whether the patient is having fever, cold, sore throat, and with the radiological evidence, with X-ray findings. And suspect case with autopsy finding consistent with the pathology of respiratory distress syndrome without an identified main cause. And if the patient dies and if it goes for autopsy and find out there is a respiratory distress without any identifiable cause, then we can say it is a probable case of SARS, and it has to be notified to the health authority, and the area where the patient has been living has to be monitored, and everyone has to be health educated so that they can be following all the precautions and control measures. So how are we going to prevent? So prompt identification of the case in context. So with the case definition, what is a case and contact? So properly identify, isolate those patients, and if hospitalization is necessary, hospitalize them, otherwise isolate them. Protection of medical staff treating the cases. So all the protective measures has to be given to the staff, paramedical workers, and the doctors and nursing staffs who are treating these patients. And isolation of suspects. So those who are living with the cases. So if you suspect them, they also has to be isolated unless the laboratory investigation is confirmed. And screening of international travelers. So patient coming from or moving from one place to another place with SARS cases. In those cases those patients has to be screened and to find out whether they have developed the disease or not. Timely and accurate reporting. So it has to be notified to the health authority so that timely intervention can be done before it is spreading to others. Treatment. No specific treatment of SARS for SARS. We don't have a specific treatment. It is mainly by the symptomatic, goes by the symptomatic way of treatment. Patients having fever, no for antibiotic, myalgia, cough syrup, nebulization, hospitalization, oxygen. So according to the symptoms the patient present in the patient has to be treated. So no antibiotics is attributed. Just like recovery is given with high dose of corticosteroids. So this can be tried if the patient is having any complications and having respiratory distress, then we can go for this treatment. Thank you. So these are all the acute respiratory infection and treatment. So while you are coming for the next class, I want all of you to read acute respiratory infection and SARS as well as COVID now, and I need then assignments to be submitted before the next class. And you might be having an internal assessment test maybe at the end of this month, and it will be given for 50 marks. So with the state sharpness and 2 essays. Okay, I want all of you to prepare, and your marks will be sent to your parents. And your performance will be sent to your parents. And you have to get it signed from them. So I want all of you to read well for the exam. As this antenatal case, this acute respiratory infection is very important. You can get in your clinical case presentation. You take the exam, MCQs, viva, in the practical also you have this exam, clinical social case presentation. So I want all of you to read well and complete. So respiratory infection is one of the very important topics. And next class we will go in for tuberculosis. So all of you take your book, go through the tuberculosis chapter, and then come and prepare for the next class. So in your practical classes, what will be dealt? So I think we had today, yesterday we had this biostatistics. So I want all of you to be thorough with all those biostatistics exercises. So which will be coming for a practical exam, and it is given for 10 marks. So 5 marks each for the 2 problems, and you can easily score those 10 marks if you are doing the biostatistics exercise correctly. So it's easy to pass unless you want to fail. And so I want all of you to be serious and read and come for the next class. And your assignments. So assignments, we have shared the mail ID to whom the assignments has to be submitted. So all those students has to submit their assignments in their respective mail IDs so that the faculty will be able to correct your assignments. And before next class, I want all of you to submit your assignments. So no more excuses and no more what to say. So I want all of you to submit 100% submission. Is it clear? Any doubts? You can just text me or you can put in the group so that we can answer. Anything else you want to tell? Now, note down just 3-4 questions. So, agents which is causing acute respiratory infection, treatment according to the age-wise patients, and I want all of you to write the immunization schedule. So, what are the immunization schedule and when it has to be given? So, immunization is very important. According to National Nursing Schedule, the schedule has to be written and sent in the assignments with this also. Okay. So I want to CR to collect and submit the assignments to the respective mail IDs. Okay. Thank you.